How do you find the right surgeon for whatever it is that you're looking for? Get your knee repaired, your ACL, I don't know. But, in our case, we're talking about cosmetic surgery of some kind. A lot of patients will start with reviews, realself.com, Yelp, Google business profiles, things like that. And those are great sources of information. But I think that sometimes that's a little bit backwards. I think what you want to look for first is the body of work, the evidence of the work that person does. Now, that should be in the form of photographs, videos, and things that they've written, maybe lectures that they've given. You should be able to find those things. If you're searching for, again, in our case, my case, Asian eyelid surgery, if you search that anywhere near where I live and work, my name's going to come up, not because I'm amazing or special. It's because I do it all the damn time. It's a passion of mine and it's a focus of mine. Let's say you're looking for a tummy tuck or a breast augmentation or maybe something more specific. You are looking for a revision rhinoplasty. Start out looking for revision rhinoplasty surgeons in your area or your country. Let's say you've found 5, 7, 8 surgeons who showed up when you searched for revision rhinoplasty, okay? Some of them have pretty good information out there. There's evidence, not just before and after photos of what they've done, but maybe some videos, not just airbrushed, stylized videos of them doing surgery and looking cool and smarmy and educated. You actually want to hear this man or woman talking about what they did and why. If you can see patients in live video moving around, talking, laughing, you can see how natural their tip is, how the motion of their face and the motion of their nose, because there is slight motion to the nose after rhinoplasty. You want to be able to see those things. And so once you've found a surgeon who has done a lot of whatever it is you're looking for, in this case, revision rhinoplasty, then you're going to narrow it down to, say, maybe the 2, 3, or 4 who also have a lot of nice things written about them by patients. Now, when you're looking at reviews on realself.com or Yelp or a Google business page, if someone has 1, 2, 3, 400 5-star reviews about how wonderful they are, that is statistically weird. Let's stick with the revision rhinoplasty topic, okay? If your surgeon that you're looking at has somehow performed that many revision rhinoplasty surgeries, which, by the way, take a ton of time and a ton of work to do, and 300 or 400 people have written about how wonderful they are, and all those reviews are about 5, 6 lines long and kind of sound the same, it's a little weird. That doesn't make statistical sense. So look at the reviews and look for the quality of the reviews. How much detail and information, how much emotion and backstory have these patients put into these reviews. There's a quality to the review that you need to be looking at as well. There needs to be a lot of good evidence, visual evidence, video evidence of the work they've done, the actual work, the actual results, not just the surgeon dressed very sharply in a beautiful office with marble floors and fountains or whatever the hell it is that people do to make their offices look classier and more appealing to patients. You need to look for the results. You need to look for the work. Pay attention to the reviews, not necessarily how many 5-star reviews they have, but some variability. Pretty good surgeons, great surgeons, are going to have 1, 2-star reviews out there, but they should be sort of outliers, And there need to be a couple of good, solid 3, 4-star reviews as well, because that's just real. And if people are going to see this doctor enough, they're going to have some variability in those reviews. Now, one of the other things that you can do to vet or evaluate your physician, your surgeon, is get their full legal name and their license number. You should be able to get that. Hopefully it's just on their website. My name is Chase Lay. My mom has called me Chase since I was born. That's my name. But my full legal name is something different. If you're looking for me on the California Medical Board website, for instance, it is Patrick Chase Lay. And my medical license number is A112118, something like that. It's in my lobby and it's on my website. People can go and look me up if they want to. You should be able to look up your physicians on the medical board database in whatever state or even city or county that you live in and look for any marks on their records, or just look to see if everything is kosher, everything's on the up and up. If their office is giving you a lot of resistance and they kind of have some suspicious reviews, or the whole picture doesn't look quite right to you, then maybe you want to think about going somewhere else. So start with the thing that you're looking for first. Then look for the evidence of their work. Then take a look at their reviews. People look at the reviews first a lot of times. Look at that second or third. Finally, just to round out your due diligence, try and look them up on the medical board of whatever state, city, or county that you're in. And that's all you got to do. They don't have to be friendly. They don't have the best smile. They don't have to drive the nicest car. You just need to be with the right doctor. I think something that you want to look for in a surgeon or a plastic surgeon is signs that they are willing to take care of their patients when things don't go as planned. It's nice to see patients who actually write decent reviews about their surgeons who had revision surgery by that same surgeon. I think that surgeons and doctors should take on some of the responsibility or some of the risk that a patient goes through. There's a tendency for surgeons to be sometimes very technical about what they do. They perform a surgery, there was an outcome, and in a technical sense, the outcome was good or acceptable. That's fine, but just because something that came out pretty good was performed technically correct, it doesn't mean that it was performed to the best of their ability. Maybe it was performed to the best of their ability, but could the surgery have been done a little bit differently? I think it's good for surgeons to consider that when it comes to their own work, and it's nice to find some sort of evidence that your surgeon takes pretty good care of their patients even when things aren't quite right.